Imagine your daily routine: washing your face in the morning, chewing a piece of toast, chatting with a friend, or simply feeling the cold breeze of an air conditioner. For most, these are completely unnoticeable actions. But for some, these exact actions trigger a violent burst of agony. It arrives without warning on one side of the face, a sharp electric shock that can last for a few fleeting seconds or drag on for minutes. This is a diagram showing the trigeminal nerve. You can see 3 distinct branches extending across the jaw, cheekbone, and forehead, all converging back toward the brain. When this specific nerve is affected, the condition is called trigeminal neuralgia. Normally, this nerve acts as the main sensory highway for your face, relaying basic touch, temperature, and pain signals directly to your brain. But under this condition, the nerve misfires. It begins to interpret a gentle brush of wind as massive physical trauma. Reaching for a standard over-the-counter painkiller won't help here. Those medications are formulated to treat tissue inflammation or dull muscle aches. They are completely powerless against this kind of erratic electrical nerve firing. Without a targeted medical approach, people suffering from this condition retreat from life. They become terrified to brush their teeth or eat a meal, trapped by the fear of their own daily routines. So what exactly breaks down inside the head to cause this vesically chaos? Look at this cross-section near the brainstem. A pulsating blood vessel presses tightly against the trigeminal nerve bundle, a neurovascular conflict. With every heartbeat, mechanical friction strips away the nerve's protective coating. The exposed fibers then short-circuit, misdirecting touch signals as intense pain. While a compressing blood vessel is the most common culprit, there are other physical factors. Coating can degrade naturally with age, or from conditions like multiple sclerosis. Rarely, a small tumor causes pressure. Sometimes the exact trigger remains hidden. Because the root of the agony is a physical defect, treating it requires locating the exact point of failure rather than just masking the pain. The journey to relief starts with a highly detailed clinical and neurological exam. A doctor maps out the exact triggers and traces the specific pathways of the facial pain. Here is a stylized rendering of a brain MRI, focusing closely on the brainstem region. Getting this imaging is the critical next step. The scan allows doctors to rule out tumors or lesions. Crucially, it lets them hunt for the exact microscopic spot where a blood vessel collides with the nerve. Once the doctor physically sees the conflict on the scan, the guesswork ends. The patient can then step onto a clear, specialized ladder of medical and surgical treatments. The first treatment step relies on specific prescription drugs, typically anticonvulsants or neuropathic medications. Instead of reducing inflammation, these drugs work at the chemical level. They calm the nerve down, stopping the abnormal electrical firing before a shock occurs. However, patients may build a tolerance to these drugs, or side effects become too heavy. When medication is no longer viable, neurologists turn to advanced procedural interventions. One immediate option is a trigeminal nerve block. A specialist injects local anesthesia combined with a steroid near the nerve root to temporarily cut off the transmission of pain signals. For minimally invasive options, doctors can perform radiofrequency ablation, using controlled heat to deactivate the specific nerve fibers transmitting pain. Alternatively, balloon compression inflates a tiny balloon to apply gentle mechanical pressure that disrupts the pain signals. Whether chemical, thermal, or mechanical, these procedures all share the same goal: intercept the errant signal so the brain never registers the pain. If those methods fall short, gamma knife radiosurgery offers a highly targeted radiation treatment. It damages the painful nerve fibers precisely without requiring a single surgical incision. The ultimate fix is microvascular decompression surgery. A surgeon inserts a microscopic buffer pad directly between the pulsing blood vessel and the trigeminal nerve. By physically separating them, the nerve is safely shielded. This permanently addresses the root cause, offering lasting, pain-free relief. Patients can manage daily triggers by avoiding extremely hot or cold foods, shielding against cold wind or AC, and washing with a gentle touch. You do not have to endure a cycle of arbitrary facial shocks. Modern neurology provides proven physical solutions to repair the faulty wiring and restore your overall quality of life. Escaping the pain begins with a careful diagnosis from a specialized neurologist who understands this condition. For expert treatment, reach out to Dr. Pradeep Kotam, Senior Consultant Neurologist at Rajagiri Hospital, or pre-book an appointment at NeuroCare Clinic in Muvattupuzha. Trigeminal neuralgia is a fierce condition, but with the right specialized care, you can stop the shocks and reclaim your normal life.